Hello and welcome to Chairside Live. I'm your host, Megan Strong. Thank you for joining me. In today's episode, we're taking you back to the first ever Glidewell Dental Symposium, held this year, November 2017 in Dallas, Texas. It was a full-day symposium focusing on tools and techniques for clinical and business success. 11 incredibly bright and talented dental leaders hit the stage, one of which was Dr. Stephen Barrett. So, if you weren't able to attend this symposium, have no fear because Chairside Live is here to give you a front row seat to some of the action you may have missed. In this clip from Dr. Barrett's presentation, Quality Provisionals for Aesthetic Success, he's given us the scoop on all of the advantages of Biotimp's Provisionals. Let's listen in.
Dr. Stephen Barrett has been practicing dentistry for over 25 years. He began his career by joining the private group practice, Greenberg Dental and Orthodontics, which now has over 80 different locations in Florida. Dr. Barrett currently serves as the clinical director and senior partner at Greenberg, where he directs the in-house continuing education program and mentors dentists as they join the practice. In his presentation, Quality Provisionals for Aesthetic Success, Dr. Barrett will provide tips on how to increase case acceptance and patient confidence through simple techniques.
When we think about some of the advantages of Biotemp Provisionals, we're going to think about aesthetics. And typically we think about the form or the shape of the tooth. But there is a very emotional component related to aesthetics. And I'm going to share with you this morning some videos from some of my patients as they're taking a look at their provisionals for the first time. When you think of aesthetic changes, we can change arch form in our provisionals, gingival recontouring. We can develop ovate pontics. We can change the lengths of teeth, whether we're shortening them or changing the position. These are not Biotemp Provisionals, right? These are not aesthetic provisionals. But yet I see these all the time as I travel around. And I have hundreds and hundreds of photographs. This is a Biotemp 5 through 11, a very aesthetic looking provisional. And I believe that it's a stepping stone to the final result. So any changes that you'd like to incorporate into the case, you want to do that into your provisional. If we're changing the arch form, we can ask the lab to go ahead and change the arch form for us. And if you look at it in the patient's mouth, we've done that. And you really can see it when you look at a lateral view. And this is how the patient leaves the office. If you're going to do crown lengthening, you can put in a nice quality provisional, and it's a great predictor of the final case. A case where we're doing crown lengthening. A nice Biotemp provisional, and we want to incorporate into that provisional all the things that we would like in our final restorations. And we can remove the provisional, we get great healthy tissue, we seat a great case in a nice healthy environment, and we have a very happy patient. And if you look at the patient before and after, you can tell we've made a tremendous change in her life. This is a patient that had some aesthetic concerns. So this is the provisional the day that we started her treatment. We did some gingival recontouring on 5, 6, 8, and 10, 8 and 9. And this is how we left her after about an hour and a half of treatment. She's still numb in this photograph, but you can already see the changes that we're making in her smile. And if we look at her full face, again, she's slightly numb because this was right after the seating of the provisional. We're already starting to make some changes for her.
Connect them like this. I can wear this for the rest of my life now. Don't even bother ordering it. Look, you ready?
I'm ready.
1, 2, 3.
Ah, it looks awesome.
Isn't that cool?
Yes, beautiful.
You're not going to see me
God.
here often now. You're going to miss me.
I will. I'm going to miss you so much.
Look, isn't that pretty?
Beautiful.
Thank you, guys.
You're welcome. Smile really big.
I can't. This lip is like numb.
Is that what you thought it would look like or better?
No, I never thought it would look this good.
Awesome.
Yeah, I never thought I would have this much nice smile. Now I can have lots of selfies.
Lots of selfies.
Yeah.
So that's kind of the reaction that you like to get for your patients when they look at their provisionals. We're going to look And another patient, this is Rosie. And obviously there were some concerns with number 7 being super erupted and a cant to her smile. Everything that I do usually starts with an aesthetic mock-up. And that's a way for me to not only visualize what I want to do, but it helps the patient to visualize what I'm going to do for them. This is the Biotemp Provisional the day that we seeded it. And we're trying to develop an ovate pontic on number 7. And you can see from a lateral view that we've done a pretty good job. And this is how she leaves the practice. 8 weeks later, she comes back. We're going to do final impressions. And I wasn't really thrilled with 8 and 9. And I wanted to add a little length to those teeth. So we did a little more gingival recontouring, reworked the provisional. And when she left that day, she's slightly numb in this photograph. But look at the difference that we've made in her smile. And we're certainly headed in the right direction. This is another case. This is Casey. Casey's 17 years old. And recently she had 7, 8, 9, and 10 done. So crowns that were just recently done. If you look at it from a lateral view, there are some things that we'd like to change. Not only the color, but also the length and the arch form. We certainly can improve upon that. So we're ordering a Biotemp Provisional. This is fiber reinforced. And this is what the immediate placement of the provisional. And from a lateral view, we can see we've really corrected the color, the length, the arch form issues that we started with. And if you look at her full face smile as she leaves the office, certainly much happier person. The nice part about this case, this happened to be on a Friday afternoon. She's 17 years old, and what's important to a 17-year-old? Saturday's homecoming. And so she sent me a picture of homecoming, and she can smile in her provisional. So that makes me happy. Some other advantages that you can achieve with Biotemp Provisionals. Certainly strength, we can add fiber or wire. Great retention. If they're relined properly, they'll stay on really well. Just as a tidbit, I cement mine with IRM, and they are color stable. So this is what the wire would look like. That may be if you're using a large splint, maybe it's going to be in there for 6 months or more. You can use fiber if the bite is tight, if it's going to be a shorter duration, and they'll stay color stable. So in these two photographs, there's 8 weeks between when we did the case, and the color hasn't changed at all. To me, this is the most important thing, right? And this is important for everybody in this room. You want a preview of the final case. We all would like to have predictable outcomes, fewer remakes, and better lab communication. So this is a Biotemp Provisional, and this is the final case, and you can see how they mirror each other. This is where the case started. That's the provisional and the final case. And if we look at our patient, you can see what a change that we've made in her life. If you need help designing the case, someone walks in, this patient's missing number 6, there's some implants that are missing. So what am I going to do with the spacing, right? As part of doing a Biotemp Provisional, it's going to be done in a digital environment. So the lab is going to do a mock-up. They'll send me the mock-up, I can approve it, and I liked what they did. We went ahead and fabricated the provisional, and this is the provisional in place. And this was the digital mock-up, and if you look at that compared to the final case, it's a great predictor of what the case is going to look like. And then the final case. Referrals from patients. Really, for me in my practice, this is really important. The patients want to come back. A lot of patients have had bad experience with their provisionals, and we want to change that. Building confidence in the doctor and in the staff, but really in the eyes of the patients, we want to build confidence. And less chair time. So let's look at Sandy.
Wow. I have like teeth. And this is what they'll look like.
Better. They'll look better.
Wow. I can't wait till I can film my face this morning. Wow.
So nice reaction, there's some emotion there. I always ask my patients to contact me, whether it's a text or an email, phone call. Let me know how they're doing their provisionals, which I asked Sandy to send me a few pictures. This is what she sent me. So my question is, do you think she likes her temporaries? Do you think she's a great referral source for our practice? I think so.
Thank you, Dr. Barrett. And again, if you weren't able to attend the first Glidewell Dental Symposium, be on the lookout for news about upcoming events that you won't want to miss. And you can always follow us on social media. You can find us on Facebook and Instagram to make sure you are always in the loop. Well, that about wraps it up for this episode of Chairside Live. So on behalf of everyone here at Glidewell Dental, thank you for watching, and I'll meet you right back here next time.